Today I'm going to discuss care after a cardiac catheterization. A cardiac catheterization, or a heart cath, is a procedure that is done when the patient is admitted to the hospital with complaints of chest pain or shortness of breath, or it can be done when a patient has an outpatient stress test that is positive and shows signs of ischemia. A heart cath is a procedure that is to be done as a diagnostic procedure or as interventional, which would mean requiring a stent. It is done by a cardiologist by inserting a small catheter into the artery of the femoral artery or the radial artery, and it allows the physician to look for blockages within the heart. The procedure is done in a cath lab after the doctor has explained the procedure to the patient and has had the patient sign a consent form. Monitoring after the procedure is very crucial. Brantner. My name is Paula. I'm going to be your nurse today following your heart cath procedure. It looks like you did have a stent placed during your procedure today, and that was used to open up a blockage in one of your vessels to improve blood flow. The doctor did not use a closure device on the vessel, so that means that you're going to be on strict bed rest for 6 hours, and they used your femoral artery and went in through your groin, so that means that you have to keep your leg absolutely straight for that 6 hours. We're going to have to monitor your blood pressure. That's going to be done in cycles of 15, 30, and 60 minutes. And we have to watch for a significant increase or a decrease in your blood pressure, and also keep an eye on your heart rate. We're going to check your pulses in your foot routinely, and that is done to make sure that there was no damage done to the vessel that could cause a loss in your pulse. We're going to check your groin site frequently to assess for bleeding. There can be bleeding from the site, and there can also be bleeding underneath the skin, which is called a hematoma, and the area would get very hard and firm and may be painful. We're also going to assess for pain. We're going to ask you frequently if you're having any pain at your site or if you're having any chest pain. A small amount of chest pain is normal after a heart cath, but if you develop serious, severe, or crushing chest pain, you need to let us know as soon as possible. Hi, Ms. Brantner. I'm going to be giving you your post-cardiac cath instructions and what to watch for when you go home. You had a stent placed during your procedure. Did your doctor explain that you would be started on a new medication? You'll start taking Plavix. It is not a blood thinner, but an antiplatelet. It causes the blood to be less sticky, and this is to keep the blood from sticking to the stent that was placed and causing a reocclusion or a clot in that area. There's no blood work that needs to be done or diet restrictions that need to be followed. You just need to take the medication once daily in the morning. It can cause an increase in bleeding if you are cut or injured. It may just take longer for you to stop bleeding and may need to apply a little more pressure. You had dye inserted during your heart cath, so we need you to drink plenty of fluids to try to flush that dye out. Right now there is a Band-Aid on your site. You may change that daily. Keep it dry as possible, but you want to keep your site covered for 1 to 2 days. No strenuous activity or exercise or lifting for 1 to 2 days. You may shower, but you are not allowed to bath or submerge the site into water for 7 days. If you develop signs of a heart attack, which include chest pain, shortness of breath, sweating, nausea, and vomiting, you need to call 911 immediately. It is rare, but if you would start bleeding from your site, you need to apply pressure and call 911 immediately. If you develop redness, warmth, pain, or a pussy drainage from your site, you need to let your doctor know. This may be sign of an infection. If you develop any blue color or your limb feels cold, you're going to want let your doctor know immediately. This could be a sign of a blockage or damage to your vessel. When you go home, you're going to call your doctor who performed your cardiac cath, which is your cardiologist, to make a follow-up appointment, and it's usually within 1 to 2 weeks.